Ashish. This is a particular type of Strep A, isn't it? Invasive Strep A. How worried do parents need to be?
Parents need to be vigilant, but not unduly concerned. Sam, I've been talking to pediatric consultants about Strep A and this particular Strep A outbreak for the last couple of weeks. We're seeing more cases. There's definitely an uptick in cases that any pediatric consultant anywhere in the country will tell you. We are seeing what might be considered more children dying than you would normally see in a winter. But we haven't had this around for the last couple of years because of the pandemic and because of the restrictions on movement. The infection hasn't been able to spread. So Strep A is a very common bug that children and adults will pick up most of the time, nearly in all cases. You might have a sore throat or present with the sort of symptoms that you might have with a really bad cold or a throat infection or tonsillitis, and you will recover from that. But certainly the three tragedies that we are aware of, the one in Surrey, the one in Wales very recently, and today the tragic news of a child in West London as well, that tells us that there is a higher amount of more dangerous cases affecting children in a more dangerous way. But we mustn't be alarmist, and we mustn't be saying that there is a surge in cases and that all children are going to fall ill and some will become very ill and will have to go to hospital and ultimately some may die. That said, it is important, and public health officials will say the same thing, that parents who will be worried, naturally you'll be worried about protecting your own children, should just be vigilant of the signs. And if they're worried and if they think something is affecting their child's health, they should contact their doctors and seek medical advice. This is what the public health director, an expert, a consultant in communicable diseases in Public Health Wales, told Sky earlier about the signs that parents should be aware of.
What we're asking the parents across Wales, in fact, not just with the school, because just one case occurring doesn't mean that there is a much more higher risk to all the children in that school. But parents in the class that we have contacted, we're asking them to look for if their child has got tonsillitis, sore throat, and or high fever, and or if they might have any severe muscle ache or redness. If they do have these symptoms, then we're advising parents to contact their doctor, who may decide to prescribe antibiotics.
Dr. Adriana Gini saying what most doctors will be telling you, that these are treatable with antibiotics, and if parents suspect that their children have these symptoms, to seek medical advice.